Hello students, good morning. I am Dr. Narendran from Department of Oral Maxillofacial. So today's topic which I am going to talk about is on maxillary nerve block. So let's start the topic with a thought: never stop believing in hope, because miracles happen every day. So local anesthesia is a maxillary region related to maxillary division of trigeminal nerve. So first nerve block that you are going to see is there's totally nearly 5 nerve blocks that you come across in the maxillary nerve blocks. This is the first one, that is posterior superior alveolar nerve block. So one of the frequently used nerve block in dentistry, the anesthetic solution is deposited behind the tuberosity near the posterior superior alveolar nerve before it enters the maxillary sinus. Here you can see the maxillary nerve which is coming down, and you can see the posterior superior nerve also there. So the nerve block will be exactly on that particular area. So posterior superior nerve block, otherwise known as the tuberosity block or zygomatic block, is used to achieve anesthesia of the maxillary molar teeth up to the first molar, with the exception of the mucobuccal root. So one of the potential complication of this technique is the risk of hematoma formation from the injection of the anesthetic into the pterygoid plexus of veins, accidental puncture of the maxillary artery. So this you need to note, because when you give this posterior superior nerve block, the only complication that you come across is hematoma. And the aspiration prior to the injection is indicated when PSA nerve block is given. Okay, so the indication for this technique is needed to anesthetize some multiple molar teeth. So you anesthetize almost all the molar teeth in the maxillary region on a particular quadrant, but exception of the mesiobuccal root. So an individual coagulation disorders must be taken to avoid injections into the pterygoid plexus or puncture of the maxillary artery. So 25 to 27 gauge short needle is preferred for this technique. You should not use a long needle. So how do you give this nerve block? So first thing is technique. Identify the height of the mucobuccal fold over the second molar. This will be an injection site. So please don't forget, the injection site is the second molar. Okay, second molar will be an injection site. Okay, in the mucobuccal fold. Hold the syringe, the bevel towards the bone. So you know where the bevel is, and the bevel should be facing towards the bone. Okay, so insert the needle at the height of the mucobuccal fold above the maxillary second molar at 45 degrees angle directed. So you will insert into the second molar, but it should be angulated into 45 degrees. Okay, angulated directed superiorly and medially and posteriorly. So one continuous movement. Okay, you should not be taking out and pulling it out. So you insert it in the second molar region in the angulate of 45 degrees. Advance the needle to the depth of 3/4 of the total length. So no resistance should be felt while advancing the needle through the soft tissue. So if you find any resistance hitting over the muscle or the bone, you just pull it out and again insert it again into the same direction. So if the bone is contact, the medial angulation is too great, slowly retract the needle without removing it. You can retract it, but you do not remove the needle fully. So and bring the syringe barrel towards the occlusal plane. This will allow the needle to angulate slightly more lateral to the posterior aspect of the maxilla. Prior to the injecting, one should aspirate 2 planes to avoid accidental injection into the pterygoid plexus. So always, you know that the most common complication is hematoma because of pterygoid plexus. So always aspirate in the 2 planes. Okay, you aspirate, then you start injecting the solution. After the first aspiration, the needle should be rotated 1/4 turn. The operator should then re-aspirate. Okay, you aspirate it, then turn it up slightly again and again re-aspirate it, and then proceed with your nerve block. If positive aspiration occurs, what do you mean by positive aspiration? Is like when you aspirate, when the blood comes through the syringe, then it is called as positive aspiration. That means you are near the vessel. Okay, you are puncture the vessel or near the vessel. Slowly retract the needle 1 to 2 millimeters, re-aspirate into 2 planes. Successful injection technique will result in an anesthesia of the maxillary molars with the exception of the mesiobuccal root of the first molar in some cases, and associated soft tissue on the buccal aspect. So in this nerve block, what are things? You have the 6, 7 and 8. Maybe it is 1/6 or 1/7 or 1/8, or maybe in the other quadrant it may be a 2/6 or 2/7, 2/8. So all these 3 molars will get anesthetized. Okay, only one quadrant will get anesthetized, exception of the mesiobuccal of the first molar. So as I told you before, I have already told you about the complication. When you come into the complications, the hematoma is commonly produced by inserting the needle to the posterior into the pterygoid plexus of veins. So when you are inserting it more posteriorly, then it might injure the pterygoid plexus of veins. So you take a short needle. This minimizes the risk of pterygoid plexus. Next nerve block that you are going to see is the middle superior alveolar nerve block. So okay, the middle superior alveolar nerve block is useful for the procedure where the maxillary premolar teeth or the mesiobuccal root of the first molar require anesthesia. Although not always present, it is useful if the posterior and anterior superior nerve blocks or supraperiosteal infiltration fails to achieve adequate anesthesia of this technique. So even sometimes you cannot, in some cases the middle superior nerve block will be absent, and if that is not working out, you go for the anterior superior and the posterior superior nerve block. So individuals in whom the MSA nerve is absent, the PAC and ASA nerves provide the innervation to the maxillary premolar teeth and the mesiobuccal root of the first molar. So even the mesiobuccal root of the first molar will be anesthetized, the root. Okay, so 2 premolars and the mesiobuccal root of the first molar will be anesthetized in this MSA nerve block. Contraindications include acute inflammation, infection in the area, injection of procedure involving the tooth, a local inflammation will be sufficient. So how do you give this technique? The technique again for this nerve block. Identify the height of the mucobuccal fold above the maxillary second premolar. So the injection site will be the maxillary second premolar. So this will be an injection site. So in the previous PSA we saw the second molar, but in this case in the MSA nerve block, that is the middle superior nerve block, your injection site will be the second premolar. Okay, so please don't confuse with the second molar and premolar. Okay. Retract the lip with the retraction instrument and insert the needle until the tip of the above apex of the second premolar. So you retract the lip, you find the mucobuccal fold, insert the needle above the second premolar till it hits the any bone or muscle, whatever it is, till the insertion. You just insert in the needle, aspirate and give the nerve block. Aspirate the injected solution slowly over the course of 1 minute. Don't rush up the solution. Give it slowly. So successful execution of this technique provides anesthesia to the pulp, surrounding soft tissue and the bone, first and second premolar and the mesiobuccal root of the first molar. So contraindications, infections or inflammation in the area of injection or needle, insertion of the drug, deposition. Okay, so when there is an infection or inflammation of that particular area, this could be a contraindication. The next nerve block that you are going to see is the anterior superior nerve block, the ASA nerve block or the infraorbital nerve block. The anterior superior nerve block is infraorbital nerve block is a useful technique for achieving anesthesia of the maxillary central, lateral, canine as well as surrounding soft tissue on the buccal aspect. So in the patients that do not have MSA nerve block, I have already told, the ASA nerve block innervate the premolar teeth and the mesiobuccal root of the first molar. So indication for this technique includes procedures involving multiple teeth and the inadequate anesthesia from the supraperiosteal technique. So 25 gauge of needle is preferred in this technique. So technique, how do you give this ASA nerve block? Place the patient in a supine position. Okay, so identify the height of the mucobuccal fold above the maxillary first premolar. So your injection site will be maxillary first premolar. Okay, so this will be an injection site. Identify the infraorbital notch on the infraorbital rim. Okay, you know where is the infraorbital notch is. Okay, so you have the infraorbital notch somewhere here and you have the infraorbital rim below that. So infraorbital foramen lies just inferior to the notch, usually lies in the second premolar. So immediately below the notch lies the infraorbital foramen. So this will be your injection site. So from where you will direct it from the first premolar, from the second premolar will be your height there. Okay, slight discomfort will be felt when the patient in the digital pressure placed on the foramen. So when you have a pressure over that particular area on the row of infraorbital notch, you will find some discomfort on that particular, because that is where the foramen comes out. It helps for the necessary to mark the position of the infraorbital foramen when it is in the beginning. So retract the lip with the retraction instruments while noting the location of the foramen. Orient the bevel of the needle towards the bone. Insert the needle at the height of the mucobuccal fold above the first premolar. Okay, so this will be our injection site. So injection site for the ASA nerve block will be your first premolar. Okay, so syringe should be angled towards the infraorbital foramen, kept parallel with the long axis of the first premolar to avoid hitting the maxillary bone prematurely. Okay, so the needle is advanced into the soft tissue until the bone over the roof of the foramen is contacted. Okay, after the aspiration, anesthetic solution is cartridge deposited slowly over the course of 1 minute. So when you are inserting this needle, you can feel it. So you will keep your one finger over that particular area, and for the premolar region will be inserting the syringe over that area, and you can feel that the syringe which has been going inside the foramen. It should not be going into the foramen but onto the infraorbital notch area. So it is recommended that pressure is to be kept over the injection site to facilitate the diffusion of anesthetic solution into the foramen. So as I told you, you always have some pressure over that particular area when the needle has been injected. Successful execution of the technique results in anesthesia of the lower eyelid, lateral aspect of the nose and the upper lip. So these all areas will be anesthetized. Pulpal anesthesia of the maxillary central and lateral, canine and buccal soft tissues and bone is achieved in a certain percentage of people. So the premolar teeth and the mesiobuccal root of the first molar is anesthetized. Okay, so this is about the ACA nerve blocks. So we have seen all the nerve blocks which come into which are there in the buccal side. Okay, so that is we saw the PCA nerve block, we saw about the MSA nerve block, then we saw about the ACA nerve block. So these are the three nerve blocks in the buccal side. So now we are moving towards the palatal side. So palatal side, we are first going into the greater palatal nerve block. As I told you, there are totally only 5 nerve blocks that you can give in the maxillary side. So that is 3 on the buccal side and 2 on the palatal side. So the first nerve block that we are going to see on the palatal side is the greater palatal nerve block. That is one of the important nerve block that you have to know in the palatal side. So the greater palatal nerve block is useful when treatment is necessary into the palatal aspect of the maxillary premolar and molar dentition. Okay, so you need this nerve block is very important from the premolar region and the molar region. Okay, so it covers entire premolar and molar. So this technique targets the area of just anterior to the greater palatal canal. Okay, so the greater palatal nerve exits in the canal and travels forward between the bone and the soft tissue of the palate. So here the greater palatal nerve is the main nerve that we are going to anesthetize, which comes through the greater palatal foramen. Okay, so here how this foramen is that you have the palate here, then you have the palatal tissue, you have the nerve then and the bone. So it's like it comes in a sandwich type. Okay, so contraindication of this technique are acute inflammation and infection of the injection site, and so use of 25 to 27 gauge needle is preferred for this technique. So technique, how do you give this greater palatal nerve block? Okay, the patient should be in a supine position with chin tilted upwards for the visibility of the area of anesthesia. So here we are going to see it, we are going to give it on the palatal side. It is not practically possible like by giving another nerve buccal nerve, because you can see the buccal side easily, but here you cannot see the palatal side. So what do you say? You tell the patient to be in a little supine position and tilt the head upwards so that you can see the palatal area clearly. So using a cotton swab, locate the greater palatal foramen by placing on the palatal tissue. Okay, so approximately 1 centimeter medial to the junction of the second and third molar. You know where the second and third molar is? You just bisect it, like perpendicularly to that you find this greater palatal foramen. This is approximate because foramens vary person to person. Like I have in a different place and you have in different, but the area will be that, the slight millimeters will be the difference. But the approximate areas between that, okay, between the second and third at the junction, okay, not in that, and exactly you have to come towards the palate. Okay, so while the usual position of the foramen, it may be located slightly anterior or posterior of the locations. As I told you, either it would be lightly anterior or it should be in the posterior. Okay, so gently press the swab into the tissue until the depression created by the foramen is felt. So what you do is you take a swab and you just try to press over that foramen area, because that is your landmark. So from that foramen area only you will find the greater palatal nerve coming out. So the area is approximately 1 to 2 millimeters anterior to the foramen into the target of the injection site. So that will be a target of the injection site, just anterior to it of the foramen. You will find a slight depression on that particular area. Okay, when you blanch, you have a slight depression. So using a cotton swab, you apply pressure on that area foramen until the tissue blanches. So you know what is this tissue blanching is. So when you have your finger over that, you try to press over that, you find some whitish area coming out through in your finger. Okay, when you do like this. So same way on that particular foramen area, when you press over that particular area, you will find blanching. Blanching means that it becomes like slightly whitish over that particular area. Okay, so that will be a side. So aim the syringe perpendicular to the injection site, which is on 1 to 2 millimeters anterior to the foramen. Okay, 1 to 2 millimeters anterior to the foramen only you have to give, not directly to the foramen. While keeping the pressure on the foramen, inject a small volume of anesthetic solution as the needle is advanced through the tissue until the bone is contacted. Here you will find the bone contacting, where you will find a pressure over that particular area. It will not be like the buccal mucosa, the nerve block that you are giving in the buccal site. Okay, you will find the pressure, you have the pressure over that syringe, and you will be hitting the bone. Okay, you have to just give a few drops of LA is more than enough to anesthetize the particular area. The tissue will blanch in the surrounding area and the injection site. Okay, depth of the penetration is usually few millimeters. That's why I told you, just few millimeters. You will not go like the depth in the buccal site. Once the bone is contacted, aspirate and inject the anesthetic solution. So when you hit the bone, you aspirate and inject the solution. So resistance to deposition of anesthetic solution is formally felt by the operator. Usually you will find the resistance. That's what I told you. You will find the resistance. Something is you have a pressure over that area when you are giving on the syringe. Okay. So this technique provides anesthesia to the palatal mucosa and hard palate from the first premolar anterior to the posterior aspect and the hard palate and the midline of the medially. So from the premolar region, the entire area till the posterior side will get anesthetized in this particular nerve blocks, that is the greater palatine nerve block. So next important nerve block that you are going to see is the nasopalatine nerve block. Okay, this is another important nerve block. So the nasopalatine nerve block, otherwise known as the incisive nerve block or sphenopalatine nerve block, which anesthetize the nasopalatine nerves bilaterally. So here what you say is that here so far we have seen everything was on a particular quadrant. Maybe the nerve blocks in the buccal side, you give it only on one quadrant. These three like all this buccal, three nerve blocks. And the same way in the greater palatine also you can give it only on one quadrant. But here in the nasopalatine nerve block, you give it in the middle and both the quadrants will be anesthetized. Okay, so in this technique, anesthetic solution is deposited area of incisive foramen. Okay, so here from canine to canine, so that is from 1-3 to 2-3, that all the tooth will be anesthetized in this particular nasopalatine nerve block. So how to give this? The technique. So, okay, the patient should be in a supine position with the chin tilted upwards for visibility of the area to be anesthetized. So here also you tell the patient to be in the supine position and tilt his head upwards. So you can see this nasopalatine or incisive foramen area. Okay. So the right-handed operator should be in the 9 o'clock position, whereas the left-handed operator should be in the 3 o'clock position. Okay. Identify the incisive papilla. So this will be your main injection site, the incisive papilla. You know, all of you know where is the incisive papilla is, right? So the area is directly lateral to the incisive papilla in the injection site. So with the cotton swab again, so always use a cotton swab to locate the foramens or for locating it or to anesthetize on the palatal side with the anesthetic solution. So you use a cotton swab. Okay, so this is for the cotton swab pressure over the incisive papilla. So here you can see the swab over the incisive area. Okay, insert the needle just towards the lateral to the papilla with the bevel against the tissue. Okay, here the bevel should be against the tissue. Advance the needle slowly towards the incisive foramen while depositing a small volume of anesthetic solution and maintaining a pressure on the papilla. Okay, so you deposit the solution slowly, okay, towards the incisive foramen while depositing a small volume of anesthetic solution. Once the bone is contacted, retract the needle approximately 1 milliliter, aspirate it and inject the anesthetic solution over the course of 30 seconds. Okay. So in 30 seconds you have to anesthetize. When the bone is contacted, retract the needle approximately 1 millimeter, aspirate and inject it anesthetic solution over the course of 30 seconds. So blanching around the tissue and resistance or the deposition of the anesthetic solution is normal. Okay, you will find the blanching, that is very normal, that you will find on the particular area. Anesthesia will be provided to the soft and hard tissues of the lingual aspect of the anterior teeth from the distal of the canine on to the one side and the distal of the canine on the opposite side. That's how I told you, right? So the canine from the distal side of 1-3 to 1-3, 1-2, 1-1, then 2-1, 2-2, 2-3 and the distal of the 2-3. So that's 1-1-3 to 2-3, the opposite side. So both these quadrants will be anesthetized. That is nearly 6 tooths will be anesthetized in this nasopalatine nerve block or incisive foramen nerve block. That's all about the two nerve blocks. Here we have seen additionally, I have already told only 5 nerve. That is the 5 main nerve blocks. That is, first we saw about the posterior superior nerve block, next we saw about the middle superior nerve block, then the anterior superior nerve block. That is on the buccal side. And on the palatal side, we saw first the greater palatine nerve block and next we saw the nasopalatine nerve blocks. That's it. So here additionally we are going to see about the greater palatine canal approach. So this is something related to this greater palatine nerve block itself. It is a different technique that you are going to see it. So here the entire technique is, I'll just tell you in the outline of it. Here previously in the greater palatine nerve block, we are giving it approximately near the greater palatine foramen, not into the palatine. Here in this greater palatine canal nerve block, you will be directly giving inside the canal where the greater palatine nerve comes out. Okay, that is the concept of this technique. Okay, so this is for some bigger surgeries on the palatal side. So use this greater palatine canal approach. So it is not usually advised, but when there is a necessary surgery which is being needed on the palatal side, at that time you use this technique. Otherwise, you need not use this technique very oftenly. Okay, it is very difficult to think and it has a lot of complications because you directly go into the foramen, that is the canal, and it will be really very painful for the patient too when the patient is undergoing this particular nerve block. So place the patient in the supine position. Right-handed operator should be in the 10 o'clock position, whereas the right-handed operator should be in the 2 o'clock position. Identify the greater palatine foramen as described in the technique for the greater palatine nerve block. So you identify the greater palatine foramen. So that is how you need it. So the tissue is directly over the greater palatine foramen in the target for the injection site. So the direct, as I told you, The foramen will be your injection site. Okay, there's no another anything. So you find the depression over that particular area, and that will be your injection site. The technique anesthetize the maxillary nerve as it travel through the pterygoid palatine fossa via the greater palatine canal. Apply pressure over the greater palatine foramen with the cotton tipped applicator. Okay, same way as you did it. Administer a greater palatine nerve block using a foramen mentioned technique. Once adequate palatine anesthesia is achieved, gently probe with the greater palatine foramen with the tip of the needle. For this technique, the syringe should be held towards the needle is aimed posteriorly. It may be necessary to change the angulation of needle in order to locate the foramen. So sometimes you need to rightly change the position of the needle because you need to know where the foramen is. The majority canal is angled about 45 degree to 50 degrees. Okay, this is how the canal usually it will be aimed at. So once the foramen is been located, as well as the needle about a depth of 30 mm. Okay, if the resistance met, withdraw the needle millimeters and re-enter the different angle. If resistance met earlier on the operator is unable to advance the needle into the canal more than few millimeters, the procedure should be aborted and high tuberosity approach should be considered. If you are not able to visit, just discontinue and go into the high tuberosity block. If no resistance is met and penetration of the canal is successful, aspirate into two planes as described in the previous section and slowly deposit the local anesthetic solution. So as with the high tuberosity approach, the high maxilla ipsilateral side of the injection becomes anesthetized with the successful execution of this technique. So when you successfully execute this technique, what happens is that the entire on that area of that side particular quadrant gets anesthetized in this greater palatine canal brace, right from the anterior till the posterior. So thanks for your kind listening. Thank you.